Proteinuria is a condition that occurs when there is an excessive amount of proteins in the urine. When the kidneys do their function as filters, they allow additional salts and fluids to pass through while preserving proteins. Proteinuria is a condition that should not exist. Okay, let's move on to discussing the levels of creatinine. In most cases, the kidneys are responsible for filtering out creatinine, which is a waste product that is formed by the muscles during exercises and metabolic processes. When it comes to kidney health, the amount of protein that is present in the urine and the amount of creatinine that is present in the blood both provide great insights. The kidneys may not be able to filter creatinine as efficiently when they are damaged, which results in an increase in the amount of creatinine that is present in the blood. Proteinuria is a condition that occurs when there is an increase in the amount of protein that is found in the urine. This ailment is caused by the kidneys leaking protein into the urine when they are damaged. Consequently, what are some of the signs and symptoms of proteinuria? A common symptom is the presence of foamy urine, which is an indication that there is an excess of proteins. It is possible for injured kidneys to be unable to control fluid balance, which can result in swelling, notably in the hands, feet, or face, a condition known as edema. Because your body may be lacking many of the amino acids it needs from proteins, you may also suffer feelings of weariness, weakness, and an overall sense of being poorly. Kidney disease, which can appear as high blood pressure, is indicated by proteinuria. This is due to the fact that damaged kidneys are less likely to manage fluid levels within the body. The potential for an increase in your blood pressure is associated with an increase in the fluid levels in your body, which includes salts and water. Kidney damage can be caused by high blood pressure, and high blood pressure can cause kidney damage. High blood pressure is a key risk factor for renal disease, and kidney damage can lead to high blood pressure. It is imperative that the outcomes of proteinuria on the kidneys not be undervalued at this time. Continued protein leakage can be a contributing factor in the development of inflammation and scarring of the renal tissue, which can hinder the kidney's capacity to cleanse the blood. Chronic kidney disease is a severe disorder that can eventually lead to renal failure. This damage can lead to chronic kidney disease over time. Do you know that there is a vitamin that can help treat proteinuria in a short amount of time? We will discuss several highly effective cures, supplements, and techniques to treat proteinuria in a short amount of time in today's video. So if you haven't already, stick around. Now, let's get started. Number 1. Reishi mushrooms. While reishi mushrooms are not a vitamin, they are likely among the most effective natural therapies for treating proteinuria and repairing kidney damage. There are certain compounds that they contain that have the potential to provide protection to the nephrons, which are the minuscule filtration units found in your kidneys. In patients with IgA nephropathy, a form of kidney illness that is characterized by excessive protein leakage in the urine, a study that was conducted in 2018 and published in the journal Phytotherapy Research discovered that the levels of proteinuria were dramatically reduced by the use of reishi mushroom extract. It was stated in a study that was conducted in 2019 and published in the journal Phytomedicine that the use of reishi mushroom extract improved kidney function in individuals who were suffering from chronic renal disease. This was accomplished by lowering inflammation and protecting kidney cells from injury. Furthermore, research indicates that reishi mushrooms has both antioxidant and anti-inflammatory qualities. This indicates that they have the ability to efficiently neutralize damaging free radicals that have the potential to cause inflammation and damage to the kidneys. Other research suggests that they may also protect the outer layer of nephrons, which would result in the nephrons having a lower capacity for absorption. Proteinuria can be treated and kidney damage can be reversed with the help of this protective effect, which helps prevent the destruction of nephrons. Extracts, powders, and supplements are some of the different forms that reishi mushrooms can be found in. When it comes to the suggested dosage, it is normally between 750 and 1,100 milligrams per day. Nevertheless, it is always important to speak with a healthcare professional in order to obtain the recommended amount that is tailored to your specific requirements and condition. Number 2. Vitamin K2. Calcium is essential for bone health as well as a wide variety of other physical processes, and vitamin D enhances our body's ability to absorb calcium. The catch is that if you do not consume enough amount of vitamin K2, calcium may be deposited in inappropriate locations, such as your blood vessels or your kidneys. This is a significant concern because it can result in calcification, which is a condition that arises when there is an excessive amount of calcium in your blood vessels. This condition can lead to problems such as tight arteries, high blood pressure, and even the possibility for damage to your kidneys. When you take vitamin K2 in conjunction with vitamin D, it helps route calcium to the appropriate regions, such as your bones, while preventing calcium from piling up in areas where it could potentially create problems. Therefore, taking vitamin K2 in addition to vitamin D can be a good idea, particularly if you already have high calcium levels in your blood, if you have proteinuria, or if you have kidney impairment. Number 3. Magnesium. People who suffer from renal problems usually have a magnesium shortage. Inadequate magnesium levels can cause disruptions in the body's ability to absorb vitamin D, which is essential for proper functioning. Numerous studies have demonstrated that in the absence of sufficient magnesium, approximately 75% of renal patients end up accumulating vitamin D, but are unable to make good use of it. Calcitriol is the form of vitamin D that interacts with vitamin D receptors and produces its biological effects. Magnesium plays a significant role in the conversion of vitamin D into calcitriol, which leads to this result. It is therefore possible that the conversion of vitamin D into calcitriol can be hindered in the absence of sufficient magnesium, which in turn reduces the activity of vitamin D within the body. Furthermore, magnesium helps the body absorb vitamin D from the intestines into the bloodstream, which is a direct benefit of magnesium. Therefore, having adequate amounts of magnesium helps to guarantee that your body is able to absorb an adequate amount of vitamin D from the foods you eat or the supplements you take. Try to consume between 400 and 420 milligrams of magnesium on a daily basis for adult males, and between 310 and 320 milligrams of magnesium on a daily basis for adult females. Complete grains, nuts, seeds, and leafy green vegetables are all good sources of magnesium that you can consume in sufficient amounts. If your healthcare provider recommends it, you may also take magnesium supplements in addition to taking magnesium supplements. Number 4. Angiotensin receptor blockers. The term ARBs refers to angiotensin receptor blockers, which are frequently employed in the treatment of a variety of disorders, including high blood pressure, heart failure, and renal ailments. One of the ways that angiotensin-converting enzymes, ARBs, work is by inhibiting the action of a hormone known as angiotensin II. A rise in blood pressure is the result of this hormone's ability to force blood vessels to constrict. ARBs are able to reduce blood pressure because they suppress angiotensin II, which causes blood vessels to relax and widen. As a result of this relaxing effect, the pressure within the glomeruli, which are the filtering units of the kidneys, may be reduced, which in turn helps to lower the amount of protein that is being lost through the urine. In order to show your support for our mission to assist in the improvement of your health, please make sure to like this video and subscribe to the channel. We will see you in the upcoming video and we appreciate you watching. Thank you. Have a nice day.